As everyone knows, the Medicare enrollment period is really fast approaching, and it's unfortunate, but there even some of the changes have not yet been announced or finalized. And so we're going into this with as much. I'm going into this with as much information as I have. There's always going to be information that you can get online through the Social Security Department or through Medicare online, or some if you might reach out to some of your local agents who are licensed in Medicare. eHealth is a really great one for everyone to go into. It helps you do comparisons with plans. But because if you're new to Medicare, you're thinking about going on Medicare soon, or you are incorporating Medicare with your employer benefits, this is a great time to look at your current plan and to go back and see if you need to change based on maybe you have some more health issues that are going on, treatment's going to change, and maybe going into a different type of plan. This is the time of year where you can go in and change some of your plans. So I think it's very important for everybody to look at that and review those so you can have the best plan for you. So we're going to go over the Medicare, the basics. A lot of you are aware of, some of you may not be, and it changes all the time. And 2022 changes. You'll notice that through here, whenever I do have changes, I've highlighted that in red so you can look at those, make note of those things. One thing I do want to point out is Social Security is going to have one of the biggest raises this year. It's going to be close to 6%. However, I think to just say I got 6% Social Security, so I've got more money in my pocket, that's not necessarily the case because the cost of your Medicare is going up for everything. So every year there are changes to Medicare, the plans, the costs, the provider participants, and then we have expansions in states that were not there before. So also we must be mindful of the changes to the pharmaceuticals and treatments that are covered in the Medicare plans. It's a lot to keep up with. I totally understand what you guys are dealing with. However, cancer patients must be diligent and review these changes so that necessary changes can be made within the Medicare guidelines, so that costs can be managed as best as possible. So keep in mind, again, this isn't all the changes for 2022. Some of those things are still coming through. So some of the changes have not been finalized and reported, and this is what we know so far. Next slide. So these are some of the areas we're going to cover. I'm not going to go into depth with all these because this will turn into a all-day thing, and I'm sure that you guys would rather be doing something else. We're going to cover the parts of Medicare, what they cover, enrollment dates, how Medicare works with private insurance, why you need to review your Medicare plan and options every single year, Medicare costs for 2022, as far as what I know, Medicare Part D, prescription coverage, what you need to know before you enroll in Medicare Advantage or Medigap Plan. This is very, very important. Medicare Advantage plans, what they do or do not cover. Supplemental plans or Medigap plans, what they do or do not cover. Creditable coverage, the cost of waiting to enroll, Medicare and stem cell transplants. I've gotten a lot of questions regarding that. We're going to cover that. Tricare and Medicare, HMOs versus PPOs, which is very important for you guys to understand. How pre-existing conditions can affect enrollment, additional cost of Medicare based on your income, and can you pay for your Medicare premiums out of pocket, and what are the tax implications of premium payments? So we're going to touch on all these things. So Medicare Part A and B are considered original Medicare. Medicare Part A covers inpatient hospitalization and is provided zero premium to you as long as you have more than 40 hours, Medicare hours are paid into Medicare for 40 hours. If it's below that, it's tiered down as to what your premium is going to be. However, what you do have is deductibles in the Medicare Part A for 2022, and they rose from $1,364 to $1,408. So that is a big change for your Medicare Part A. If you're already collecting Social Security benefits, either through retirement, disability, or Railroad Retirement Board benefits, you will generally be automatically enrolled in Medicare Part A and B when you become eligible. For disability, it is after your 24th month of disability. If you're not collecting Social Security when you become eligible for Medicare, you must enroll through the Social Security office at 800-772-1213. Now, keep this in mind. If you just forget, there's going to be a penalty you're going to carry with you for the rest of your life. So you need to really be up on this. Generally, they will send out a notice to let you know that it is time to enroll. So you can go into your local Social Security office if they are not closed down. A lot of them are closed down for in-person visits during COVID. They may have picked up that same thing in certain places. You can also reach them online. Always be mindful that waits are very long. Next slide. So if you don't qualify for automatic enrollment again, you can sign up during your initial enrollment period, which begins 3 months before your birthday, the month of your birthday, and then for 3 months after, for a total of 7 months. Do not wait for the last minute to do it. I mean, right now you might find wait times on getting information, or you didn't get all the information to them that they need, can hold you back, and you don't want to end up going over that period of time and end up with more cost. So your Medicare Original Part B covers outpatient services and other medical care provided by doctors and healthcare professionals, as well as durable equipment. Part B also covers a premium. The premium for 2022 has increased from $135.50 to $144.60, and the Part B deductible has increased from $185 to $198. Late enrollment penalty is 10% for every 12 months you miss your initial enrollment period. So please keep these dates and all of this in mind. Next slide. So there's additional costs for high income beneficiaries. A lot of people aren't aware of what this cost is and if it can actually be changed. And I will tell you that it can. So for those of you who enjoy a higher income, the premiums for Part B and Part D has increased for the 2022 year. The income brackets have been adjusted in accordance with inflation. The high income thresholds have been increased to $88,000 for individual. Those earning over $88,000 per year will now meet the first tier of additional Part B premium costs, where the cost increased from $144.60 to $202.40. Remember that increase you got on your Social Security? You can see how fast it's being eaten up. And this is what happens every year. Next slide, please. So tax deductibility of Medicare premiums, I will tell you that anytime you're paying anything out of pocket for your healthcare, prescription, co-payments, deductibles, co-insurance, any of these things you have to pay out of pocket, keep these receipts because you can actually claim those on your taxes. So monthly Part A and B premiums are tax deductible if premiums are paid through your Social Security check. The premiums will be removed from your taxes. And in addition, all medical services not covered by Medicare are tax deductible. However, only to the extent the expenses exceed 7.5% of your adjusted gross income. Remember, I'm saying adjusted gross, not your gross income. So you had to do all these exemptions and everything else after that. And so a lot of people, especially if you have high costs for prescriptions, you can see that you can easily get to that 7.5% or above that relatively quickly. For self-employed individuals who are Medicare beneficiaries, the premiums can be deducted before taxes, which lowers your adjusted gross income. So for those people who aren't aware of that, if you are a self-employed individual, have your own company, business, these things can be tax deductible. Your premiums can be. Now, I mentioned earlier that if you are a high income earner and your premiums are higher, they usually go back 2 years. If your income actually drops, you can actually go back and request them to reduce your costs for your premiums. So a lot of people forget to do that, or they assume that's the way it's going to be, but you can request that your premiums be adjusted based on a lower income. Next slide. So Medicare Part C, or the Advantage plans, a lot of people take Advantage plans to help cover either other premiums, co-deductibles, or give them additional coverage for things that your regular Medicare Original Part A and Part B does not cover. So Medicare Part C or Medicare Advantage plans is a Medicare approved plan, which encompasses Medicare's Part A and B. So they're all rolled into one thing. They are provided through a private Medicare approved insurance company. It combines all of your Medicare benefits into one convenient plan, except for hospice care, which is covered by Part A. The Advantage plan must cover all the services from original Medicare. It also covers prescription drugs as well as supplement to cover over-the-counter medications, a benefit if you are advised to take supplement vitamins. Routine dental diagnostic service such as x-rays and oral surgery. Next slide. vision care, routine eye exams and eyewear, hearing care, routine exams and fitting for all hearing aids, and additional inpatient stays. It may cover additional days in acute hospital care and skilled nursing care. There's co-payments on a lot of those after a certain period of time, and I would, because it's so complicated, I would suggest you look at those things. If you find yourself in a hospital, and like my husband did on several occasions, and if you're in bed for a period of time, you may find yourself having to go to rehabilitation, go into a in-person stay, and those dates and those times can add up. So Medicare Part C costs and benefits. Some Medicare Advantage plans, Part C, may offer a zero monthly premium. However, you will still have to pay your Part B premium. Also, Medicare Advantage plans have maximum out-of-pocket limits. That means there is a ceiling on how much you will pay for each year before the plan covers all of your healthcare costs. Now, if you only have a Medicare Part A and B, there is no ceiling because it only pays 20% is left in your pocket to have to pay. Many Advantage plans offer low or no deductibles, but be aware, different Advantage plans offer different options, or different coverage. So you need to look at those things, make comparisons based on what your health treatment is right now and what you anticipate in the future. Because some of these things, once you get on them, it's hard to get off and get onto some other plan because, of course, you have a pre-existing condition. Next slide. So again, Medicare Part C Advantage plans, there are some disadvantages you must be aware of. For Advantage plans and HMOs, health maintenance organizations, you may be limited in the providers you can see and face higher fees if you go to an out-of-network provider. These plans may give you more freedom, but premiums, copays, and deductibles may and probably will be higher. Complex plan offerings are based on your zip code. So if you have a doctor, your regular oncologist, or your specialist in different zip codes, you might want to be aware that they may fall in or out of your network. And it's very often that providers who are under the Advantage plans, they fall off quite regularly. So you don't want to end up in the middle of a treatment and you find out your provider is no longer in that Advantage plan. State-specific coverages are in specific areas. So you need to be aware of what is actually covered in your area or the areas you need to have your treatment. You must be cognizant that the CMS, Center for Medicare ratings for your Medicare Advantage plan, which rates quality of care provided by Medicare Advantage and Part D plans. You may find that some coverage is rated a lot better and others may not be. You may have heard of lawsuits coming down where funds were being funneled from Medicare and providers were doing that. It's not as uncommon as you may think it is. You only hear of the few cases, so you need to always be aware of what the ratings are for the Medicare Advantage plans that you have signed up for. Additional fees for drug deductibles and special visit copays may be applicable. So this is important because they measure things like management of chronic conditions, availability of care, member experience, drug pricing, and more. So be aware of how your Advantage plan is rated. Next slide, please. So there is a additional cost for the Medicare Advantage plans. And like I said, Medicare Advantage plans, they offer certain coverage depending on which plan you get, but there's nearly a 4.1% increase across the board for your Medicare Advantage plans for this year, for 2022. So approximately 42% of Medicare eligible beneficiaries were enrolled in private Medicare Advantage plans, and this number will increase. Additionally, the number and variety of plans will increase, making it very difficult to make a good decision on the best plan for your needs. It's not uncommon for certain people in certain states to have over 60 different options, and that becomes very difficult if sometimes you find you may have to call each individual insurance company. Like I said, ehealth.com, they are really great with your state, your zip code, looking at what doctors you have, what kind of treatment you're getting, including prescriptions, to make sure you get the best plan for you. But I'm not going to tell you just to go out and get a Medicare Advantage plan or get an HMO or PPO. That is going to be based on what your needs are. But there are some things you need to be aware of that we're going to cover later on in this presentation. So whatever you do, don't just have what you have now may be good, but it may not, and it may be based on what upcoming changes to your treatment is. I would encourage you to at least review what you have and the new options to make sure you're covered as best as you can be covered. The results of not looking at this could be very, very costly. Next slide. So types of Medicare Part C, things people aren't aware of, Medicare Advantage plans. HMOs or health maintenance organizations plans utilize in-network doctors and require referrals to specialists. So if you are a myeloma patient or a cancer patient or somebody who has a chronic or long-term illness that requires more than one specialist, like rheumatologists and things like that, you may want to get a plan that's going to make sure that everybody's covered, that you have a lot more flexibility, because putting in requests for referrals, you may find yourself waiting for a long time. Preferred provider organizations or PPO plans charge different rates based on in-network or out-of-network services. Private fee-for-service or PFFSs plans are special payment plans that offer provider flexibility. Special needs plans or SNPSs all provide help with long-term medical costs for chronic conditions. Now, most of these things you're going to look at when you're looking at Medicare Part C. Those are going to be what's going to be important for you to look at when you decide, if you decide you want to take a Medicare Advantage plan. Make sure you get the best one for the best coverage for you. Next slide. The medical savings accounts, or MSAs, plans are medical savings accounts paired with high deductible health plans. Just like you can get a regular health plan through your provider, through your employer, and you get a high deductible, you can get a health savings plan. Work very much the same. Next slide. So Medicare Part D is your prescription plan. So Medicare Part D plan helps people with Medicare Part A and B pay for brand name and generic prescription plans or drugs. Private insurance companies contract with Medicare to provide this coverage. So they have standalone Medicare Part D prescription plans are designed to work in conjunction with Medicare Part A and Part B coverage, or the original Medicare. And then you have Medicare Advantage prescription drug plans combined with Medicare Part A and B and prescription drug coverage in a single plan. And then through Plan D may also be optional. The cost of drugs may be a strong incentive for enrolling in a Medicare plan that provides prescription drug coverage. And you may face a late enrollment penalty if you delay enrollment. So for all of those out there who are listening to me, if you are older, we don't anticipate our health to get better, even if we don't have a chronic or terminal or long-term illness, then at some point you're going to be on some kind of prescription drug plan. If you wait to enroll at 65, 66, 67, 68, then it's going to cost you a lot more to get into those plans. So it may be to your advantage to look at what your prescriptions are now, and what you anticipate they may be. There may be hereditary things in your family, or you may already be managing an illness. Make sure you don't forget to enroll in this. If you have coverage, creditable coverage at work, make sure that once you're no longer at work, you do pick up that Medicare Part D, so you won't have ongoing penalties for the rest of your life. Next slide, please. When can you join Medicare Part D? So when you first become eligible for Medicare, and each year from October 15th through December 7th. October 15th through December 7th, the open enrollment period is for people who are making changes. Or if you happen to have your birthday to fall in those period of times, then it's also like your initial enrollment period. If you lose creditable coverage through no fault of your own, you will also be eligible for a 2-month special enrollment period, which is called a SEP, to join a Medicare drug plan. You can get Medicare prescription coverage as a standalone Part D plan or as part of a Medicare Advantage plan, Part C. This is offered through private insurance companies whose plans are contracted through Medicare. You will need to have Medicare Part A or Part B to get a standalone plan, and will need both Parts A and B to get a Medicare Advantage plan, and you will be paying deductibles and premiums for those as well. Next slide. So what are the benefits or costs of delaying enrolling in Medicare Part D? There are pros and cons to delaying in Medicare enrollment, especially Part D. For the benefits, if you have creditable coverage through your other benefit plan, through an employer or union group, through Tricare, which is veterans benefits, federal employer benefits, or market health insurance plans, and you can delay enrolling into Part D up to 8 months after your coverage ends before enrolling through the special enrollment period. But you don't want your coverage to end. That means you don't have any coverage at all. So it's the safest thing to do is make sure you have coverage continually without a delay or break in coverage. Cobra and Medigap do not count as creditable coverage. And it's very important to understand that Cobra, even though you may be carrying on the same plan you had through your employer, they are coded completely different. So if you're going to find yourself on Cobra, you need to go in and sign up for that Medicare Part D before you end up on Cobra. Next slide. So what does Medicare define as creditable coverage? Medicare defines creditable coverage as coverage that is at least as good as what the Medicare provides. If you have coverage through your employer, you'll get a Medicare Part D creditable coverage notice from your employer if you are covered through them. Keep this notice, as you may have to refer to it at a later date. If it's questioned or somebody said you didn't have it, you need to have this letter. This is proof that if you do not join Medicare Part D now because you have creditable coverage, you will not incur a higher premium or a penalty if you decide to join a Medicare drug plan at a later date. If you join a Medicare drug plan, your employer plan may be affected. And this could be very important for you to note. Whenever you decide to make a change, drop, add, if you drop your employer plan and you join a Medicare drug plan, your dependents may not be able to get this coverage back. So you need to look at not just how's it affecting you, but if you have any dependents, a spouse or children on your plan, and you decide to drop it because you're going to get your Medicare drug plan through Medicare, be aware they may not be able to get their coverage back. Next slide. So what is the cost of not enrolling in Medicare Part D? If you drop your employer coverage and do not join Medicare within 63 continuous days after coverage ends, you will pay a permanent higher premium for the Medicare plan. The cost may go up at least 1% of the Medicare base premium per month for every month you did not have that coverage, and you may have to wait until the following October to join. So not only will you be incurring a higher penalty, you will also have a period of time where you may not have any coverage at all. Next slide. So the disadvantages of delaying Medicare Part D enrollment: your costs could be quite high if you need prescriptions as a result of illness or injury. And if you need to enroll, you may have to wait until the next annual enrollment period. Until then, all costs is out of your pocket. And if you are on anything like Revlimid, Velcade, those are extremely, extremely expensive prescriptions. So make sure you don't have a lapse in coverage. Late enrollment penalty calculated from the initial enrollment eligibility day, and you did not have creditable coverage for 63 days. So you're going to have a penalty. The monthly premium, these are things to note that are changes for 2022. The monthly premium for Medicare Part D has increased for 2022 from $31.47 to $33. The deductible is $480. The high income premium brackets for Medicare Part B and D have risen to $88,000 for individuals. Over $88,000 income will meet the tier 1 that we mentioned earlier of additional Part B premium, where the cost increases from $144.60 to $202.40. Next slide. So Medigap or supplemental plans. They're called two different things, Medigap or supplement, but they are the same thing. Medigap plans are offered through private insurance plans. It can pay for some of your original Medicare Part A and B cost, but there are certain times and situations where you're eligible for Medigap. It's not all the time, but it's a lot more flexible than joining your regular Medicare Part A and B. Medigap complements your original Medicare Part A and B coverage by covering what is not covered through your it almost picks up the costs or the things that your Medicare Part A and Part B does not meet. It helps with certain out-of-pocket costs that original Medicare doesn't cover. If you're age 65 and you have Medicare due to a disability, your eligibility for a Medicare, if you're under age 65, your eligibility for a Medicare supplement coverage may depend on the state that you live in. Not every state offers Medigap plans for people under the age of 65. So it's very important, if you find yourself under age 65 and you think you're going to automatically fall into Medicare and you can get some options for that, you need to call your state insurance board and find out what you will be eligible for. Next slide. There are 10 standardized Medicare supplement plans in 47 states, remember I said 47th, Minnesota, Wisconsin, and Massachusetts, they offer their own standardized plans. So, and they all cover a different range of Medicare out-of-pocket costs. So it's very important to do some comparison shopping out there. Medigap plans do not include prescription drug plans, so that you had to get a standalone plan like your Medicare Part D. Um, your supplement plan will pay for a portion of your out-of-pocket that Medicare Part A and Part B does not cover. And it differs by plan for deductibles, co-insurance, co-payments. That is left up to that private insurance company as to decide how they're going to charge you for your coverage. In most cases, in order to qualify for Medigap, you must be enrolled in Medicare Part A and B original Medicare coverage. Next slide. The best time to enroll in supplemental plan is generally supplemental or Medigap plan is generally during your Medicare supplement enrollment period. For most people, that starts the month you turn 65 and have Medicare Part B and goes for 6 months. So you see all these different dates, initial enrollment period, when you first become eligible 3 months before your birth date, the month of your birth date, 3 months after. Now for Medigap, it's another thing. It starts the month you turn 65 and you have Medicare Part B and it goes for 6 months after your birth date. You can get what is available in your area, regardless of the health issues you may have. This is called guarantee issue. And the insurance companies cannot charge you a higher rate or deny you coverage based on your health conditions. This is considered guarantee issue rights. Now remember, this is when you're first eligible. However, the company is allowed to make you wait up to 6 months before covering your pre-existing conditions, after which they will cover these pre-existing conditions, just like they would cover anything else. This waiting period may even apply if you enroll during your Medicare supplement open enrollment period. So because this is not a Medigap is not a Medicare approved program, they are a complement to your Medicare program. So you need to be very aware of taking advantage of getting into a Medigap plan if you can. Medigap generally covers a lot of those expenses that Medicare Part A and B don't cover, and they don't drop off like some of those Medicare Advantage plans do with providers. Next slide. After your Medicare supplement open enrollment period is over, you can apply for a Medigap plan anytime. But if you apply without guarantee issue rights, the insurance company can request you go through medical underwriting, which can be very difficult if you have a pre-existing condition such as cancer. And they may charge you a higher rate if you have health problems, and they may not even accept you. So it is not uncommon for people to not be accepted in the Medicare supplement. So if you're eligible to get into a Medicare supplement and you haven't enrolled to that in Medicare Advantage, I would look at the comparisons, because if you miss out, you may not have the opportunity to get back in there again. So the exceptions to this rule are exceptions to everything. Medicare supplement plans go back. If a Medicare supplement plan go bankrupt or misleads you, you may be eligible to change that supplement plan. Also, next slide. Federal law does not require states to provide supplement plans to people under the age 65 that I mentioned before, but many states do have this requirement. Check your state laws at www.ehealth.com. ehealth.com is also a site where you can go and talk about comparisons between Medigap, Medicare Advantage plans. So it's to your advantage to reach out to them. Medicare supplement plan costs will depend on the specific plan you have and its coverage when you're enrolled, how the company prices its premiums, and which insurance company you purchase the plans from. So there's a lot of different variables that go into how they purchase their plans for Medigap, because they are not regulated the same way that the Medicare original plan A and B and Medicare Advantage plans. Next slide. So can you switch between Advantage and Medigap plans? Supplement plans do not work with Advantage plans. There are a lot of caveats that must be considered, and that is why it's important to review your plans before enrolling in Medicare, and especially within the year of enrolling. After that time, it may be difficult to move among them, especially due to pre-existing conditions. It is possible to go from a Medicare Advantage to a Medigap plan if you're within 12 months of originally enrolling in Medicare Advantage. After that time, it's very difficult to go in there. So be aware of your timetables for everything. Next slide. Medicare versus Tricare. So Tricare for Life is a health insurance which qualified military retirees and their eligible dependents. It is different from Medicare. So Tricare can work with Medicare for military retirees. It provides a wraparound plan for people who are eligible for both Tricare and Medicare when they're already retired. Is Medicare is Medicare needed if you have Tricare? It depends on your military status. If you're active duty or qualified for Tricare through an active family member, you can typically delay enrollment into Medicare Part B without additional penalties or costs later on. Next slide. If you are retired, Tricare says you must enroll in Medicare Part A and B if you are enrolled in Tricare for Life. Your covered spouse should also enroll in Medicare's Part A and B when they reach the age of 65, or if your spouse has not yet turned 65, he or she can remain on Tricare. When the spouse then turns 65, they should enroll in Medicare's Part A and B along with Tricare. Coordination of benefits, active military Tricare, active military is Tricare. Tricare for Life is when you're retired, will pay for Medicare covered services and may also pay for healthcare costs that Medicare does not fully cover. Retired military Tricare for Life Medicare pays first for anything it covers, then Tricare for Life works with supplemental insurance. Tricare exception to this pays for services from military or federal healthcare facilities, even if Medicare would cover at another facility. So you have options of facilities. You can go to a veterans hospital or veterans doctors, or you can go to a different facility and they will still coordinate that care. Next slide. Many Medicare beneficiaries who have Tricare also will add an Advantage plan because it will provide coverage for routine dental, vision, and hearing, as well as gym memberships. When enrolled in an Advantage plan that coordinates with Medicare and Tricare for Life, there will be Tricare for Life will be primary insurance first for covered medical expenses. Tricare for Life is the opposite. It will act as a supplemental plan when retired military is enrolled in an Advantage plan, with the Advantage plan being the primary insurance. Typically, Tricare for Life will pay for expenses not paid by Medicare Advantage plans, such as co-payments, co-insurance, or deductibles that would normally be paid out of pocket. You may end up with no out-of-pocket expenses at all if you coordinate your care correctly. You do not need a prescription drug coverage as Tricare exceeds the requirements by law. One of the only places you're going to find that your prescription drug through Tricare is exceeding the requirements by law. Next slide. So Medicare coverage for stem cell. This is one of the it's a question that comes up quite often through patients. So Medicare coverage for stem cell therapy will only apply to services that the FDA approves, and the treatment must be medically necessary for Medicare to cover it. I know there's a lot of questions out there, and there's a lot of people who are saying, no, 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 I know the doctor said it's medically necessary, but I'm still being denied by Medicare. It's unfortunate Medicare goes to it's a testing program they had years and years ago, almost 20 years old, and they have not updated staging and updated any of these things. And it's frustrating. And it's trying, and Medicare will push back because they're paying for it. So it's a very difficult thing that people are trying to get changed. It's just, we need a lot more lobbyists. Single autologous stem cell is covered for Dury Salmon stage 2 or 3 patients that are newly diagnosed or responsive multiple myeloma, including patients with previously untreated disease, a partial response to prior chemotherapy, 50% decrease in either measurable paraprotein serum or urine, or in bone marrow infiltration sustained for at least 1 month. And those in responsive relapse must have adequate cardiac, renal, pulmonary, hepatic function, and must be less than or equal to 77 years old. Tandem transplants for myeloma are not covered. All other uses of autologous stem cell transplants for multiple myeloma are not covered. So I've heard of change or exceptions to these rules, and it's going to be based on your doctor fighting back. And you got to find a doctor who's aggressive to make sure that you're going to get some of these covered. My husband had 3 stem cell transplants. One was the first one was in February, the second was in November, and he was stage 3. And then he had another one years later, almost 6 years later, and it was covered. They were all covered through Medicare. So you got to fight and make sure you're working with a specialist. That also helps your case. Next slide, please. So Medicare is complex, and timing for Medicare Advantage, for coming out of your employer benefit, for signing up for Advantage or Medigap, when you can do that, when you can make changes. Timing is everything, because if you miss out or you don't sign up for something, there may be penalties that you'll carry with you the rest of your life. I would encourage everyone to seek out the help of a certified agent that can walk you through the coverage options based on your health, place of treatment, and your doctors, as well as the need for flexibility. Here's an area I want to cover real quickly. To choose HMO or PPO. Your preferred provider organizations are generally providers where you can go, like I said, without having to get a referral. It gives you the most flexibility in your treatment, and it gives you the most coverage. So I would, if you're having problems with getting your coverage where you are now in your state, or if you don't have a myeloma specialist in your state, it's to your advantage to look at switching over to a PPO plan. Just do some comparisons, and also check your prescriptions and your other options through your Medicare Advantage plans. And if you need to switch among your Medicare Advantage plans, or if you're within 12 months of signing up, if you need to go to a Medigap plan, please review that. eHealth is a great place to go. They'll help you with pulling up the prescriptions you have, your current treatment, and you can even talk about possibly upcoming treatments that may be coming up in the next year or so, whether it's stem cell transplant, CAR T cell therapy. It's to your advantage to look at all these things now, so you won't be stuck later. So if you currently have Medicare but need to pick up additional coverage through Advantage or a Medigap supplement plan, please review your eligibility. Consider your current treatment plan and anticipate future treatments such as stem cell, like I mentioned before, CAR T cell therapy, clinical trials, all these things, as you need to make sure you have the best coverage for your needs now and in the future. If you are new to Medicare, please plan accordingly, as you may not have the option to change plans at a later date. Next slide.
I think that's it, Diana. The next one's just questions.
Okay. Whew, deep breath.
You did it. You did such an amazing job, and we've been getting people from, asking or thanking you for the incredible research that you have done in going through, all of the information that we need to process, and coming up with this information, and you did it in record time too. I'm really impressed.
Wow.
Yeah, take your drink of water, and thank you for sharing that. It's now time for question and answers, and Diana again has done incredible research on this and is going to do her best to answer the questions, so feel free to enter them. We have several coming in, so let's start with this one. If you have standard Medicare A and B, does that include Part D, or is Part D separate?
Part D is a standalone program. You have to enroll in Part D.
Okay, perfect. Robin is saying $88,000 is the higher income for individuals. What's the amount for couples combined together?
I believe that's at 144, between 141 and 144. I'm not sure which one.
Okay.
It did go up as well.
Awesome. Okay, Liz is saying she has Tricare. She was just sent a Medicare card, eligible as of January 2022. She has been on Medicare disability for almost 2 years. Does she need to accept the Medicare benefits right now, since she will have employer coverage for another 4 years or so?
No, but I would encourage her to enroll in at least the Part B, because that's the one that it may not be creditable coverage unless you get that notice. And you may have penalties and fees associated with that. Again, reach out to eHealth they will go over all of those with her, depending on what state and everything she's in and what options she has. So remember, Massachusetts, Minnesota, and Wisconsin have different plans that are available out there. And also look at your treatment, what it is now, because your treatment may not stay the same this year to next year. You want to make sure you get the best coverage.
Yeah, yeah. Eileen is wondering, is it easy to change Part D plans during the annual open enrollment period?
To change Part D,
Mhm.
yes, it should be. Just go to eHealth and ask them, and especially if you're anticipating additional costs in your pharmaceuticals, or your income change, and so your out-of-pocket co-payments and deductibles will be higher. Yes, you can change your Medicare Plan D.
Perfect. Rita's wondering if Medicare deductibles are figured on calendar years.
They are from January 1st to it's from January 1st to December 31st.
Wonderful. Cassie is a little still confused, even though she says thank you so much. She's a little confused about the difference between Advantage plans that include prescriptions and Advantage plans that don't. Can you speak to that again?
Yeah, there are different Advantage plans that you can sign up for, and Advantage plans have different premiums associated with them as well. There are some that are basic Advantage plans that will cover Part A and B. There are A and B originals combined with your Advantage plans, and others will pick up additional services like prescriptions, hearing, and all those things, and prescriptions. So you can get a Medicare Advantage plan that does not have prescriptions at all, and then you'll have to pick up the Part D standalone, or you can get a Medicare Advantage plan that includes prescriptions as well. And the cost is going to be based on what coverage you have under that Advantage plan.
Okay, thank you. Barbara is saying they live in Minnesota, have original Medicare A and B, and a great BCBS supplement plus a Part D plan. They want to change the Part D plan during open enrollment because present Part D is $66 a month and going up. Would like a lower priced Part D plan, but of course Revlimid is on there, which is pre-approved. Is there a different plan to pre-approve Revlimid? Could a different plan be used to pre-approve Revlimid?
That's kind of confusing, the question you're asking. But I'm not aware of all of the plans that Minnesota has. Again, this is where it's state specific. You'd have to reach out to either a broker, an insurance broker, or the eHealth, and have them run your prescription drugs, whether the ones you have now, or talk to your doctor. They may anticipate you changing you to something else later on down the road, so that you can make sure that you get the best coverage for you. I don't know. I can honestly tell you there are hundreds and hundreds, and each state it may have the same kind of. It may say Kaiser here, and maybe Kaiser different state, but their coverage may be different. So there's no way one person can